Did you know that compassion-focused therapy, or CFT, was inspired by evolutionary psychology and has become one of the most promising approaches for tackling self-criticism, shame, and more? Stick around because today I'll guide you through the fascinating origins, components, and latest evidence of CFT for 2025 and why it's more relevant than ever. Hi, I'm Dr. Steindl, and welcome back to Compassion in a T-shirt. Here we explore the science and practice of compassion, breaking it down so everyone, whether you're a therapist, student, or simply curious to find pathways to well-being, can join the conversation. Let's dive into the heart of CFT, the therapy of wisdom to understand our experiences, of strength and courage to face our struggles, and of making a commitment to respond with compassion, not just to others, but also to ourselves. So where did CFT come from? It all started with Professor Paul Gilbert, who noticed a big opportunity to enhance how traditional therapies addressed self-criticism and shame. He brought together insights from evolutionary psychology, neuroscience, and Buddhist philosophy, as well as the psychotherapies, to create something truly unique. I interviewed Paul earlier in 2024, where he discussed some of his latest work, not least his work differentiating concepts of safety and safeness, which was super interesting. The idea behind CFT? Our brains are wired for survival, but that wiring comes along with trade-offs and can sometimes lead to our suffering, often via an overactive inner critic. CFT helps calm that critic by activating our compassionate mind, the part of us that nurtures, soothes, and connects. It's a therapy with a big heart and a bold mission, helping people tap into compassion to heal and thrive. And it's not just for individuals, it's about improving relationships, communities, and even systems. All right, let's break down the nuts and bolts of CFT. At its core, CFT focuses on three emotional systems: the threat system, the drive system, and drumroll, the soothing system. These systems evolved to keep us safe, motivated, and connected. But modern life? It has our threat and drive systems working overtime, while our soothing system often gets left behind. So CFT uses mindfulness, body-based practices, imagery, and compassion exercises to balance these systems. Think guided meditations, emotion regulation, compassionate letter writing, chair work and embodiment, and ultimately visualizing your ideal compassionate self, your inner friend, guide, mentor, that part of you with a big caring heart. And hey, if your ideal compassionate self wears a superhero cape or rocks a tiara, whatever you like, that's completely up to you. But let's not pretend compassion is always easy. Have you ever felt like being kind to yourself was just too hard? You're not alone. Many people experience what we call fears, blocks, and resistances to compassion, or FBRs for short. These are those inner barriers that can make compassion feel uncomfortable or even threatening. Maybe someone worries that being compassionate will make them weak or let others take advantage of them. Or they're afraid that self-compassion will stir up painful emotions. Sound familiar? It's actually incredibly common. Research, including my own paper on this very topic, shows that these FBRs are a critical part of the therapeutic process in CFT. So how do we work with them? First, it's about validating that these fears make sense and exploring where they come from. Perhaps past experiences of vulnerability or difficult caregiving, care-receiving situations growing up. Then we help clients test those fears gently using practices like compassion-focused imagery and small acts of self-compassion. It's about building confidence that compassion isn't dangerous, but rather a powerful ally. By working through these FBRs, clients can truly open themselves to the transformative potential of compassion, and that's where the magic happens. the link to our open access paper, Therapist Perspectives on Working with Fears, Blocks and Resistances to Compassion in Compassion-Focused Therapy, is down below in the description. In my book, The Gifts of Compassion, published in 2020, I dive deeper into all of this, including how our emotional systems, collectively known as the 3 circles model, impact our emotional well-being and how we can cultivate our soothing system to restore balance. And the book helps us identify and work through FBRs and develop our compassionate selves to support us through difficult life experiences. The principles in the book and the many exercises and practices it contains are just as relevant today as ever, helping us build a more compassionate approach to ourselves and others in this fast-paced world. If you want to level up your understanding and practice of CFT, there's a book you've got to check out. Essentials of Compassion-Focused Therapy, a Practice Manual for Clinicians by Nikki Petrocchi, James Kirby and Beatrice Baldy. This 2024 manual has been a long time coming, and it's truly the go-to resource for anyone working with CFT. It's a practical, step-by-step guide to implementing CFT in your therapy practice. Whether you're new to CFT or looking to refine your skills, this manual is packed with value. It breaks down complex concepts and techniques in a way that's easy to follow. But it's not just theory. It's hands-on with ready-to-use scripts, handouts and diagrams that you can take straight into your sessions. The authors have done an incredible job of making CFT accessible and actionable, which is exactly what we needed. I interviewed Beatrice recently about the manual, and she gave a wonderful description of the modular approach they've taken and the structure and flexibility that they've built in. Now, where can you apply this approach? Pretty much anywhere. CFT started as a therapy for people struggling with severe self-criticism and shame, but it's grown to address a wide range of challenges. Anxiety, depression, trauma, eating disorders, CFT can help. Regarding the treatment of eating disorders, research published in October 2024 by Carrie-Anne Vrabel and colleagues compared cognitive behavioural therapy and compassion-focused therapy for eating disorders. A fascinating randomised controlled trial investigated how these 2 therapies stacked up against each other, especially for individuals with a history of childhood trauma. Eating disorders are such an important focus of psychological treatments. And while CBT is the most researched, it doesn't work for everyone, especially for people with complex cases, like those who've experienced trauma. So, this study had a real focus on that group, comparing the effectiveness of CBT against CFT in an intensive treatment setting. The study involved 130 patients, half of whom had a childhood trauma history, and looked at outcomes at pre-treatment, post-treatment, and at 1-year follow-up. The results? Both therapies were effective in reducing eating pathology, basically the symptoms of the eating disorder itself. But here's the kicker. For those with a history of childhood trauma, CFT had much better long-term outcomes. After a year, people who'd received CFT maintained their improvements, whereas those who had received CBT didn't fare as well in the long run. This study really highlights the importance of tailoring treatments to meet individual needs, especially for those with trauma histories. While CBT is still a powerhouse in treating eating disorders, CFT offers a compelling adjunct or alternative, particularly when dealing with deeper emotional wounds like trauma. It's further proof that CFT is versatile and can be a game changer in treating complex cases. CFT is also being used in schools to teach kids and teachers the power of compassion, and even in workplaces to build more empathic cultures. One of my personal favourites, its role in addressing societal challenges like inequality and even climate anxiety through the Global Compassion Coalition. Big stuff, right? So, does CFT actually work? You bet! Decades of research show it reduces shame, self-criticism and depression while increasing self-compassion and emotional resilience. And the latest meta-analyses by Petrocchi and colleagues, published in 2024, give us a deeper dive into these effects. First, let's look at the overall outcomes. Across the board, CFT significantly reduces negative outcomes like anxiety, stress and emotional pain. The data shows consistent improvements for people facing some of life's toughest emotional struggles. It's like hitting a reset button on those overwhelming feelings. Now let's talk about depression. CFT is particularly effective here. Meta-analyses reveal that people who engage in CFT experience significant reductions in depressive symptoms. This isn't just about feeling a bit better. It's about lasting changes that help people move forward with more hope and energy. Then there's self-criticism, that relentless inner voice that tells us we're not good enough. CFT tackles this head on, and the research shows it works. People report quieter inner critics, greater self-acceptance, and a more compassionate relationship with themselves. And finally, let's celebrate compassionate self. One of the standout findings is that CFT doesn't just reduce the negatives, it also builds the positives, like compassion for others and for ourselves. Compassion grows stronger, becoming a source of resilience and strength. If you would like to learn more about the effectiveness of CFT, you can go to the Petrocchi and colleagues paper, which is open access, and the link is in the description. The paper's packed with insights and data that show how far CFT has come and where it's headed. I interviewed Nikki about the paper, and we spent time going through the results with a fine-tooth comb and highlighting the implications for CFT in practice. So, what are the key takeaways from the research into CFT generally? First, CFT is unique in how it addresses the emotional pain caused by self-criticism and shame. It's not just about managing symptoms, it's about understanding the deeper mechanisms that drive them. This approach helps people break free from the cycles of self-blame and build healthier emotional habits. Second, CFT shines as a flexible, transdiagnostic therapy. Whether you're dealing with anxiety, depression or trauma, or working to foster compassion in schools, workplaces, or even policy, CFT has tools that can adapt to diverse needs. It's like a well-stocked therapy toolbox. Third, the evidence base for CFT is stronger than ever. Meta-analyses consistently show its effectiveness, not just for reducing suffering, but also for promoting positive growth. It's one of those rare therapies that helps people feel better, become better equipped to handle life's challenges, and begin to really flourish. Fourth, CFT isn't just about individuals. It's about building a more compassionate world. Whether it's helping teachers connect with students or addressing larger systemic issues, the ripple effects of compassion are truly transformative. Now, before we finish, let's talk about some exciting innovations in compassion-focused therapy that are pushing the boundaries of the field and that might offer you some next steps. First up, compassionate mind training. Developed by Chris Irons and Charlie Heriot-Maitland, this has been a breakthrough in integrating CFT into real-life practice in the community. CMT is a structured program that's used to help individuals develop their compassionate mind, particularly in dealing with a whole range of emotional states, as well as the harshly critical style of self-to-self relating so common amongst us all. It's been adapted for various contexts, including schools, workplaces, and even for personal use, making it a powerful tool for spreading compassion far and wide. It's fantastic to see how accessible CMT has become, especially with the growing recognition of its evidence-based transformative effects on mental health. Speaking of accessibility, have you heard about the CFT-inspired Self-Compassion app? This is another huge leap forward. The app provides users with guided exercises to cultivate self-compassion, like meditations, compassion-focused activities, and reminders to check in with yourself. It's like having a little compassionate coach in your pocket. The app is especially useful for people who might not have access to formal therapy, but still want to benefit from the principles of CFT in their everyday lives. And of course, it's a great resource for anyone looking to enhance their own compassion practice. Another exciting development is the growing application of CFT among forensic populations. Researchers and clinicians are increasingly finding CFT to be effective in supporting people in the justice system, especially those with histories of trauma and violent behaviour. This is an area that's been traditionally challenging to address, but the compassionate approach really helps individuals shift from self-criticism and shame toward more constructive, healing ways of thinking and behaving. It's a significant step forward in broadening CFT's impact to those who need it most. I interviewed Karenza Hocken a few months ago about her fabulous work with forensic populations and her approach to understanding and working with human harmfulness. Finally, if you're looking to stay on top of the latest in CFT research and practice, there are some fantastic events you should check out. The Compassionate Mind Foundation's annual conference is always a great opportunity to dive deep into the latest CFT innovations. It brings together top researchers and practitioners from around the world, and there's always something new and exciting on the horizon. It's the perfect place to connect with like-minded professionals and stay updated on cutting-edge developments. Check out the Compassionate Mind Foundation via the link in the description. Last but certainly not least, we have the University of Queensland's Compassion Symposium every year. It's another amazing event where researchers, practitioners, and anyone interested in CFT and compassion and self-compassion generally can gather, share insights, and explore the latest breakthroughs in compassion research and practice. It's an incredible chance to be part of a vibrant community here in Australia that's pushing the field forward in all sorts of exciting directions. Whether you're new to CFT or already a fan, 2025 is shaping up to be an exciting year. From its evolutionary roots to its cutting-edge applications, CFT continues to show us that compassion isn't just a nice to have. It's essential for healing and growth. What do you think about the role of compassion in therapy or in life? Let me know in the comments below. And if you found this video helpful, give it a like, subscribe, and check out my other videos to keep exploring the power of compassion. Let's spread the word together.